I am a proud Houstonian, born and raised in Sugar Land, Texas, and lived in downtown Houston for the last 13 years because of this idea, right? And what I want you all to do right now is, Dr. Lumsden said, you know, this should get you going, should motivate you. Can you do me a favor? How do you check your pulse? If you either on your wrist or, go ahead. Like, let's see. Is your blood flowing? Can you feel your vitals, right? That is something we could do every day in all of our industries, is check our vitals, is to see, is our business alive? Are we moving forward? Are we able to, do another day? So let's keep this program going. Next up, we have Dr. Sarah Pletcher, System VP and Executive Medical Director of Strategic Innovation at Houston Methodist. Keep that pulse flowing, guys. Let's go. Let's give her a round of applause.
All right, so just to recap, it's Monday morning. All Joey has to do is follow a world-famous magical entertainer, but I have to follow Dr. Lumsden, who threw everything at it, right? A sizzly video, there were cute dogs, there were astronauts, there were exploding rockets. So this will be a cool down period. Your heart rate's nice and high, cool down period, gets you stoked for the rest of the day. Great, so got a couple slides for you. Dr. Malt, who's the CEO of BioIntelliSense, one of our strategic partners at Houston Methodist, can't be with us, so I'm going to share a little bit about that technology and how that fits into our innovation portfolio at Methodist, and then tee you up to hear a little bit more from Dr. Hughes. Okay, so I know we talk a lot about what problems we're solving, and that's focused today, but I also like to think about it in terms of what is the opportunity. And yes, we have lots of headwinds in healthcare, but we also have an opportunity because we haven't reimagined so many aspects of healthcare in hundreds of years. We're still doing things the same way we were a century ago. So there's huge opportunity to disrupt, not only providing a better experience for patients, but keeping them safer and doing so in a more cost-effective way. So this is BioIntelliSense, the bio button. I'm actually wearing one now. It's a tiny little device that captures a hugely rich source of data happening about our patients. We're using it across our whole system. So I'm gonna skip ahead here just to kind of get into Houston Methodist, right? So leading institution, we've been leading in patient experience and in quality, but we have to think ahead to our next chapter, to our next century. How do we continue to lead, but to do so leveraging all that's out there in terms of innovation? And as I mentioned, we haven't really reinvented some of these things, right? We haven't thought about grid, we haven't thought about ratios and in-person only, and we only do vitals every 8 hours, and we send people walking into rooms to collect vitals. So huge opportunity when you start to think about centralizing teams, automating not only data collection, curating data and presenting it, algorithms and alerts and workflows to allow us to manage information, and to do so in a way that is a better experience for the patient, right? You think about vitals, we go in and wake our patients up in the middle of the night to collect information about them, and then we don't know what's happening in between those hours that we wake them up. So an opportunity to automate that data collection and then apply algorithms to it, it's more eyes but fewer feet, and more sleep and rest for our patients, and more comfort for our care teams, knowing that there are technologies in place that are keeping an eye on our patients even as we let them rest. So we talk a lot about care redesign at Houston Methodist. We have a number of virtual services now operating from centralized teams, including ICU and stroke and psychiatry and nursing and 24/7 urgent care, virtual nursing, sitting. I could go on and on. But this wearable technology is a key tool that we put into the belt of those teams taking care of our 2,600 patients across the system. You see some of the other technologies here in addition to the wearable sensors. We also have cameras in our operating rooms, as you heard about from Dr. Lumsden, but going into every single patient room across the system. Doing AI monitoring, we can do sitting, we can beam into those rooms to check in on our patients, really transforming our ability to use scale to send in just the bits of expertise and support and care that are needed at the right time, rather than be stuck in an archaic people-sized 12-hour shift ratio increments. So I talked about the BioIntelliSense button. We've been rolling it out now since the spring. We're actively monitoring almost 900 beds right now, and it'll be in all 2,600 in just a few months. Almost 90 million pieces of respiratory rate and heart rate information on those patients since the spring. It's collecting heart rate, respiratory rate, temp, movement, coming soon more and more features and insight onto that device infrastructure. And then we're actively monitoring using algorithms in our central command center. So because of all of these efforts, we're able to give real time back to the bedside team so they can provide more meaningful care to the patient, helping them get up and walking, supporting bathing, giving more time to that patient who's having a rough moment, and then allowing the patients who are doing well to rest. So it's had a tangible impact on our ROI and on our staffing costs for the hospital, and yet at the same time, we've had some great catches. We are catching patients who are deteriorating earlier, sooner, faster, and able to intervene sooner and apply all of the wonderful care that we want to deliver to them. We just want to do it sooner. So it's really been a transformative solution for us, and leveraging something, as small as a quarter. All right, I'm going to turn it over now to my colleague. He's going to talk to you about their technology, another set of wearable tech. And thank you so much for giving me your time this morning.
That's it, Mike. My name is Dr. Dave Hughes, and I'm the founder and CEO of Novosound. We're an ultrasound company from Scotland, and what I'm going to talk about is wireless wearable ultrasound. So really, Novosound I started about 5.5 years, and we were selling technology into the oil and gas industry. Our biggest customer was in the aviation industry. So hopefully over the next 5-6 minutes or so, I'll show how we're taking our technology from the oil and gas industry, aviation, and bringing it over to healthcare. My background was actually a PhD in biomedical ultrasound. It's a whole different presentation to tell you how I ended up selling into oil and gas. But today, let's focus on wireless wearable ultrasound. Can I get a show of hands, a wee bit different from the one that we had before? How many of you have a smartwatch on your wrist at the moment? So we're getting to a point where it's more or less over the 50%. And one of the key reasons that you have a smartwatch, aside from being cool, or as cool as the ultrasound guy on stage, is that you want control over your personal health. We all want to spend, no offence to hospitals, but if we can spend as little time as possible in hospitals, that should be our goal. If we go into hospital, we want to get out as fast as possible. Smartwatches enable this, and it's really became almost like the modern Hippocratic oath. So, do no harm. Let's try and make sure that people stay as healthy for as long as they can. And as we've seen before, there are in the previous presentation, there's lots of devices, not just smartwatches. There's fitness devices, healthcare monitors, fitness devices, smartwatches, but they only monitor skin deep. They're always stuck on the outside of the body, and they measure stuff such as temperature, movement. They infer everything. They take information from the skin, optical measurements, electrical measurements, and they infer what's going on to the rest of your body. And they don't really give you a full picture of what's going on inside the body, and then nonetheless, catastrophic health events can happen. So this is where ultrasound comes in. We can enhance digital health for everyone from the hospital right through to the home, and then when you're just walking about outside. If you've been in the hospital, or if your mum was in the hospital before you came to being, you've had ultrasound, you've had an ultrasound scan. It's a safe, non-invasive way of looking inside the body. And just to tie this kind of whole Houston event back to Scotland, we invented it back in 1954. Diagnostic imaging came out of Scotland outside of Renfrew. So here I am, another Scotsman, coming out with another way of using ultrasound. But basically what we want to do is augment the wearables that you have already and add ultrasound, enhance the measurements that you've got from your existing wearables, but then add new parameters. Out of all those lists of the parameters that you saw on the biosensor, blood pressure wasn't mentioned, dehydration wasn't mentioned, and then you get into deeper, more esoteric stuff such as fluid status, muscle rehabilitation, and that's what ultrasound can provide into a smartwatch. But current ultrasound sensors, the ones that you'll see in the hospital from Philips, Siemens, GE Healthcare, they're not up to scratch. They're too big and clunky. Everybody knows ultrasound looking like this, where it's a hand against the body part and the clinician is there. It's low resolution. You need to be an expert to read the images. We solve that at Novosound with our printed ultrasound sensors. We have an exhibition room just around the corner where you can come and see this as well. And the idea is that with our printed ultrasound sensors, we're going to move ultrasound from the hospital to the home and then onto the smartwatch. And we have that today. That's what we're showing around the corner. So we've miniaturized our ultrasound sensors, and we've shown that you can, from what you were doing earlier with your finger on your neck, with our ultrasound sensors, you can put them on the neck, monitor cardiac output, but we can also do it on the wrist as well. There are other competitors trying to do this. Boston has MIT, California has University, San Diego. I'm from Paisley in Scotland. We've actually got it today, whereas our competitors are going to have it in a few years' time. So I quite like the kind of pushing the forefront of innovation. A few examples of it. So this is what we do at our core. We're a sensor manufacturer. We make ultrasound sensors that are flexible and small enough to go on the wrist. There's a picture of them next to a pound coin, which is about the size of your kind of dime. We then put an instrumentation package on it so it can be stuck on the body and generate sound waves, digitize sound waves, move them onto a cloud somewhere. But then nobody wants to look at ultrasound pictures, so we take AI and machine learning to actually get cardiac output, as you can see here. We've used other cases, so I'm going to show 2 use cases of ultrasound just to kind of create some food for thought for you when you're thinking about what problems you might have that ultrasound can solve. So dehydration monitoring. When you become elderly, you will lose your thirst response. Your body will be hungry for fluids or thirsty, but you won't know. And then 50% of cases of admissions by the elderly into hospitals can be solved just by fluid, just by hydrating a gummy or a glass of water. But that person still has to go to the hospital into that infectious environment, or in the American system, that expensive infectious environment. So how can we stop them even making the trip? What we do at Novosound is we strap an ultrasound sensor with our wearable platform to the upper arm, and you get the traditional grainy, noisy ultrasound images, and then that streams off. But then we leverage our machine learning signal processing to basically decide from the signals coming off the arm, is that person hydrated or is the hydration status falling? And that's been a really cool use case for wearable ultrasound. When people think of ultrasound, they think of baby imaging. Here it is getting used for monitoring hydration to stop people coming to your lovely hospitals. Another way, when you are as unfit as myself, your muscles start to ache and pain and you want to get them, know, are they getting better? So again, similar, we have just submitted a paper for publication where we take our wearable ultrasound platform, we stick it to the upper arm, and we use ultrasound to basically classify that muscle from a health point of view. Is that muscle in recovery? Is it loaded? Is it activated? And again, a use case of ultrasound that you wouldn't have thought of because you're used to seeing the baby images, but here we are leveraging the AI and signal processing to get information out. And the end user's never going to see these plots, but they will enable actionable insight for the clinicians. We've been proving this for the last 5.5 years in oil and gas. This is for those who are from the inspection or oil and gas energy industries or aviation, this is our flexible inspection tool that this is all based on. This is known as the Novosound Kelpie. It's a flexible ultrasound sensor that can image around lots of different shapes, and we've been selling this into the Houston area for the last 5 years or so. And now, we're looking to try and work out who in the healthcare industry wants to work on our kind of collaborative business model. The validation piece is you come to me with your problem that you think ultrasound can solve. I say, well, let's give it a shot. If it works, we'll create you a prototype. We'll then show you how to put it into your device. So who knows, maybe in 2-3 years, the bio one will have an ultrasound sensor in it, and then you can take on to production and basically help the personal health care for people. I lead the team. As I said, I founded the business 5.5 years ago alongside my head of innovation, Dan Irving, and basically a team of 40 experts working outside Glasgow, which I know Aberdeen's nothing to look at, but Glasgow is really pretty. When you come over to Pumps and Pipes next year, don't stay in Aberdeen, stay in Glasgow. But really, we're here today to basically ask if you want to join us and come up with ideas on where we can apply ultrasound, move it out of the hospital, get it into smartwatches, fitness devices, healthcare monitors, into the surgical ward, in implantable ultrasound, I don't know. But really, we've got asked to put these kind of problems together. So what is my problem? I've been asking myself that for years and years. We've got a novel way of making ultrasound portable enough to wear it. But our challenge is we're technical, we're physicists, we're selling into aviation, oil and gas, we're moving into healthcare. You guys in the room probably have a better idea of where this can be used. So we really want to talk to you to find out what problem can we solve for you with wireless wearable ultrasound. So I will stop gabbing there and hand it back, Thank you very much.
Let's give them a round of applause, guys. Welcome, well done. Amazing. Go and give that to them.